Attention! Has anyone ever told you that masturbation is harmful, that it drains your energy, makes you weak, or damages your prostate? I've been practicing urology here in Toronto for over 20 years now. And let me tell you something. I've heard every single myth in the book. The truth is, most men, especially those of you over 60, are carrying around guilt and fear about this topic without knowing the real facts. Today, I'm Dr. Natalie Brooks, and I'm here to set the record straight once and for all. I promise you, if you stick with me until the end of this video, you'll discover how this practice can actually protect your prostate and why the science backs it up completely. This isn't just another health video, folks. This is the end of unnecessary shame and the beginning of real practical knowledge that could genuinely improve your quality of life. So grab your coffee, get comfortable, and let's dive right in. You know, growing up in Canada, we don't exactly sit around the dinner table talking about these things, do we? Whether you're from Vancouver, Montreal, Calgary, or a small town in Saskatchewan, masturbation has always been one of those topics people just don't discuss openly. For generations, it's been associated with weakness, lack of self-control, and in many cases, serious health problems. I remember when I first started my practice back in the early 2000s, I had patients who genuinely believed they were damaging their bodies every time they engaged in this natural behavior. Some of them had carried that guilt for decades, since they were teenagers. It broke my heart, honestly, because modern medicine has shown us that so much of what we believed is simply not true. Here's the thing that really matters. The actual risk isn't the practice itself. The real danger is the lack of accurate information. When you don't know the facts, you end up making decisions based on old wives' tales and outdated thinking. And let me be clear with all of you watching today, especially my patients over 60. You deserve to know the truth about your own bodies. You've earned that right. So why might masturbation actually be beneficial for you? The answer lies in the biology of your body and how ejaculation affects your prostate gland. Your prostate, for those who might not know, is a small gland about the size of a walnut that sits just below your bladder. It produces fluid that nourishes and protects sperm. As you get older, this gland often becomes a source of concern, whether it's benign prostatic hyperplasia, which we call BPH, or worries about prostate cancer. It's time to leave the myths behind and embrace what science actually tells us. Now here's the revelation that medical science has been quietly documenting for years. Major studies, including landmark research from Harvard University, have found that regular ejaculation can significantly reduce the risk of prostate cancer. Yes, you heard that correctly. Men who ejaculate more than 21 times per month have a considerably lower risk of developing this disease. I know that number might surprise some of you. 21 times sounds like a lot, eh? But stick with me here because the science is fascinating. The leading theory is that ejaculation acts as a natural flush for your prostate gland. When you ejaculate, you're essentially eliminating toxins, old cells, and potential carcinogens that could otherwise accumulate in your prostatic ducts. Think of it like this. Imagine you have a cottage up in Muskoka or out in the Okanagan. If you leave it closed up all winter without ever airing it out, what happens? Dust accumulates, moisture builds up, and before you know it, you've got mold and all sorts of problems. But if you open those windows regularly, let the fresh air circulate and keep things moving, the cottage stays healthy. Your prostate works in a similar way. Keeping those ducts clear and functioning properly is a natural way to protect your health. The Harvard study I mentioned followed nearly 32,000 men over an 18-year period. That's not some small sample size or short-term observation. That's serious, long-term research, and the results were clear. Men with higher ejaculation frequency showed a significantly reduced risk of prostate cancer compared to those with lower frequency. We're talking about a reduction of up to 33% in some age groups. That's substantial, folks. But it's not just Harvard. Research from the Boston University School of Public Health came to similar conclusions. Studies from Australia, published in the British Journal of Urology International, found comparable results. The European Urology Journal has published supporting evidence as well. This isn't one isolated study. This is a growing body of scientific literature, all pointing in the same direction. So contrary to what you might have been told growing up, this practice can actually be a powerful tool for prevention. But here's where I need to pump the brakes a little bit, because I know what some of you might be thinking. Does this mean you can do it without any limits and face no consequences whatsoever? The answer, unfortunately, is no. There's a flip side to this that you need to understand to maintain balance in your life. The real problem isn't frequency per se. The issue arises when masturbation becomes compulsive or addictive, or when it becomes your only outlet for releasing tension. Addiction can lead to problems with erectile dysfunction, a decrease in libido, and even social isolation. When taken to extremes, it can deplete your neurotransmitters, causing your brain to seek dopamine compulsively. Your brain essentially gets hooked on that quick reward, and it starts needing more and more stimulation to achieve the same effect. The key point here is moderation and awareness. It's not harmful unless it becomes the only thing that brings you pleasure, or unless it starts interfering with your daily life and relationships. If you find yourself canceling plans to stay home alone, or if you're choosing this over intimacy with your partner, those are warning signs worth paying attention to. Now, I want to address something directly because I get this question all the time in my clinic, and I notice similar questions coming up in discussions about this topic online. What if you have a partner? Does masturbation still make sense when you're in a relationship? This is a great question, and it's one that causes a lot of confusion and sometimes even conflict between couples. Here's my professional take on it. Having a partner doesn't eliminate the potential benefits of masturbation. Sexual activity with a partner is wonderful, of course, and it provides many of the same prostate health benefits. But life is complicated, isn't it? Maybe your partner has a different libido level than you do. Maybe one of you is dealing with health issues that make intercourse difficult. Maybe you're in a long-distance situation, or your schedules just don't line up. Maybe your partner is going through menopause and isn't interested in sex as often. These are all normal real-life situations that millions of couples deal with. The important thing is communication. If your partner interprets your masturbation as a sign that they're not enough for you, that's a conversation worth having. Explain that it's about health, about maintaining prostate function, not about any inadequacy on their part. In a healthy relationship, both partners should be able to discuss these things openly and honestly at our age. And I'm including myself in this, folks. We should be past the point of being embarrassed about our bodies and their needs. For those of you who don't have a partner right now, whether you're widowed, divorced, or simply single, masturbation becomes even more relevant for your prostate health. You shouldn't have to worry about developing health problems simply because you're not currently in a relationship. Your body still needs that regular maintenance, that natural flushing of the prostate that we talked about earlier. Another question I hear frequently is whether it's okay to use masturbation as a way to manage stress and daily frustration. Look, life can be stressful at any age, but I think many of us in our 60s and beyond face unique pressures. Health concerns, retirement adjustments, caring for aging parents, or dealing with loss, worrying about finances. It's a lot. And yes, sexual release does provide a temporary reduction in stress. It releases endorphins, it relaxes your muscles, it can help you sleep better. Here's my honest answer on this. Using masturbation occasionally as a stress reliever is perfectly normal and healthy. The problem arises when it becomes your only coping mechanism. If you're reaching for this every single time you feel anxious, sad, or frustrated, without ever addressing the underlying issues, that's when it becomes concerning. It's like having a glass of wine to unwind after a hard day. Totally fine in moderation, but if you need that wine every single night just to function, you've got a different problem on your hands. A healthy approach includes multiple stress management tools. Maybe you go for a walk along the seawall in Vancouver, or you hit the trails in Banff, or you skate on the Rideau Canal in winter. Maybe you call up a buddy for coffee, or you spend time with your grandkids, or you pick up a hobby you've been putting off. Masturbation can be part of your stress management toolkit, but it shouldn't be the whole toolbox. Now that you understand both the benefits and the potential pitfalls, let me give you my practical protocol for using this practice safely and beneficially. I've refined this approach over my 20+ years of working with patients, and I think it strikes the right balance. First, let's talk about frequency. Based on the research, and particularly that Harvard study, aiming for somewhere between 2 and 4 times per week seems to be a sweet spot for most men over 60. That works out to roughly 8 to 16 times per month. You don't need to hit 21 times monthly to see benefits. Any regular ejaculation is better than none at all. And please don't turn this into another source of stress by obsessing over exact numbers. The goal is regularity, not rigid adherence to some perfect schedule. Second, be intentional about it. Don't do it purely out of boredom or habit. Approach it as a form of self-care, a way to maintain your health, just like you'd approach taking your blood pressure medication or doing your physiotherapy exercises. There's nothing shameful about taking care of your body. When you frame it this way in your own mind, a lot of that old guilt and embarrassment tends to fade away. Third, pay attention to warning signs of problematic behavior. Here's a quick checklist I give my patients. Are you spending more and more time on this activity? Are you neglecting responsibilities or relationships because of it? Do you feel unable to stop even when you want to? Are you experiencing physical discomfort like irritation or soreness? Do you feel worse emotionally afterward rather than better? If you're answering yes to several of these questions, it might be time to speak with a healthcare provider about it. There's no shame in getting help. Fourth, if you have a partner, keep the lines of communication open. Talk about your needs, listen to theirs, and work together to find a balance that works for your relationship. Intimacy with a partner offers additional benefits beyond just prostate health. Emotional connection, bonding, the release of oxytocin. Don't let masturbation replace partnered intimacy if that's available to you. Think of them as complementary, not competing. Fifth, don't use it as your only escape. If you're dealing with anxiety, depression, chronic stress, or grief, please reach out for proper support. Talk to your family doctor, see a counselor, join a support group. Here in Canada, we're fortunate to have good mental health resources available. Don't suffer in silence, and don't try to solve emotional problems with physical solutions alone. I want to take a moment to address something I've noticed in some of the discussions around this topic. There are people out there who believe that all this medical research is somehow fabricated, that scientists are lying to us, that there's some conspiracy to keep people sick. I understand the skepticism. Truly, I do. We've all seen cases where big pharmaceutical companies have prioritized profits over patients. But the research on ejaculation and prostate health isn't funded by some shadowy organization trying to sell you something. These are academic studies from major universities, published in peer-reviewed journals, replicated across multiple countries and populations. Is the science perfect? No, science never is. There's still debate about exact mechanisms and optimal frequencies. But the overall trend in the evidence is clear and consistent. Ignoring that evidence because of general distrust of institutions isn't skepticism. It's denying yourself potentially beneficial information. I always encourage my patients to ask questions, to be critical consumers of health information, but also to remain open to evidence-based recommendations. Speaking of questions, I know some of you watching might be dealing with specific prostate conditions right now. Maybe you've been diagnosed with BPH, benign prostatic hyperplasia, and you're wondering how this all applies to you. The short answer is that the same general principles apply, but you should definitely discuss your specific situation with your urologist. BPH involves an enlarged prostate that can cause urinary symptoms, and while there's no strong evidence that masturbation makes BPH worse, there's also limited evidence that it directly improves BPH symptoms. What we do know is that keeping the prostate healthy overall is beneficial, and regular ejaculation is part of that picture. If you've had prostate surgery, or you're undergoing treatment for prostate cancer, again, please talk to your medical team about what's appropriate for your situation. Every case is different, and what's right for one person may not be right for another. We've covered a lot of ground today, folks, and I want to make sure you take away the key messages clearly. Masturbation is neither inherently good nor inherently bad. It's a tool. Just like a kitchen knife can help you prepare a nutritious meal or cause harm if used carelessly, masturbation's impact on your health depends on how you approach it. The science has demonstrated that with moderation, it can be a healthy practice that actually helps protect your prostate. The real problem emerges only when it becomes compulsive, when it isolates you, or when it replaces rather than complements a healthy life. You have the power to use this knowledge for your benefit. You have the ability to take control of your own health, to make informed decisions based on actual evidence rather than outdated myths and unnecessary guilt. At our age, we've earned the right to understand our bodies and care for them properly without shame. I've been Dr. Natalie Brooks, and I've truly appreciated you spending this time with me today. If this video has helped clear up any misconceptions for you, I'd really appreciate it if you could hit that like button. It helps more people find this information. And if you know someone, maybe a buddy from the hockey league, a neighbor, a family member who might benefit from hearing this, please share it with them. We men don't talk about this stuff enough, and that silence isn't doing us any favors. Make sure you subscribe to my channel, Dr. Natalie Brooks, for more straight-talking health information aimed at men over 60. I've got plenty more topics to cover, and I promise to always give you the honest truth backed by real science, not sensationalism or scare tactics. Before I sign off, I want to ask you something. What questions do you still have about this topic? What myths have you heard that you'd like me to address in a future video? Drop your thoughts in the comments below. I read every single one of them, and your questions help me understand what you need to hear. Let's have this conversation openly, without shame, because that's how we all learn and grow. Your vitality is your greatest treasure. Take care of it, take care of yourselves, and I'll see you in the next video. Stay healthy, Canada.